Diabetes affects cancer development. Diabetes is caused by long-lasting hyperglycemia. It is a condition that can cause organ damage. If hyperglycemia persists, the blood vessels and nerves become degenerated and complications arise. Major complications of diabetes include eyes, kidneys, nerves, heart, and blood vessels. Westernization of eating habits and habit of sitting and working. Diabetes due to various stresses can lead to serious deterioration of quality of life. It is a disease that requires management because it causes fatal complications. Acute complications versus chronic complications. If high blood sugar levels persist and you do not get treatment, acute or chronic complications due to diabetes occur in a variety of ways. Acute complications of diabetes can occur when you are not receiving treatment properly or for some reason, refers to a relatively rapid onset of ketone acidosis, hyperglycemic coma or hyperglycemia. It occurs literally very suddenly and causes severe symptoms. Life is often threatened, but it can be restored if the bomb is over. Chronic complications, on the other hand, since it progresses gradually over several years, it is easy to overlook. If it occurs once, it is often not recovered again. Therefore, a truly horrific complication is a chronic complication. Even without the current symptoms, chronic complications of diabetes mellitus damage the organs over time, mainly in the blood vessels and nerves. What is the relationship between diabetes and cancer? Diabetes is not only an independent risk factor for the development of some cancers, it is also known to play an important role in cancer progression. Several studies have shown that the risk of various cancers in diabetic patients. The mortality rate of cancer patients with diabetes is 1.41 to 1.55 times higher than that of non-diabetic cancer patients. Therefore, it is very important to lower the incidence of cancer in diabetics and to find them early. In recent studies, diabetes care has been shown to reduce cancer incidence and increase survival rates. Patients with diabetes are known to frequently occur liver cancer, pancreatic cancer, kidney cancer, endometrial cancer, colorectal cancer, bladder cancer, non-Hodgkin's lymphoma, and breast cancer. 30 of pancreatic cancer patients have diabetes. In Korea in 2001, 30 of pancreatic cancer patients have diabetes. Similar results were released in Japan. Despite many advances in treatment modalities, pancreatic cancer is difficult to detect early and is less likely to be cured. Even patients who were able to undergo resection of pancreatic cancer, the recurrence rate is high, and even after resection, the 5-year survival rate is 10-20, which is a very poor prognosis. It is reported that the incidence of pancreatic cancer is high in males aged 50 years or older, people who eat meat or fat, and smokers. In addition, diabetes has also been found to be associated with pancreatic cancer in many documents. If sudden diabetes or diabetes mellitus is severe and diabetes is not controlled, pancreatic cancer needs to be questioned. If you have type 2 diabetes, the risk of developing pancreatic cancer is 1.8 times higher. People with long-term diabetes and family history. Suddenly, people diagnosed with diabetes need to undergo tests for pancreatic cancer. If I only control my blood sugar, can I prevent complications from diabetes? Once complicated, chronic complications are difficult to treat. Therefore, it is best to prevent rather than cure. Once diabetes has developed, the rate of complications should be slowed down by regulating blood sugar to normal. In order to prevent chronic complications of diabetes, blood glucose control is essential. However, controlling glucose alone cannot prevent chronic complications. Concomitant cardiovascular risk factors should be adjusted together. In other words, control of hypertension and dyslipidemia and smoking cessation are essential. Thank you for watching the video. I'll come back with more informative information.